prevention and treatment of vegetative disorders when seasick and emotion. Tests were conducted on machines and in real conditions of marine, anti-aerial and transportation aviation. It was for the first time in the history of physiotherapy and medical technology that the device and the method of electrotranquilization was included into the instructions for medical supply of flights in the aviation of the Air Force of the USSR by the order of the head of USSR Air Force from the 12th of April 1991. It was also included into the supplies of the ships of the USSR Navy. The studies that were conducted in the Institute of Microbiological Problems have defined the effectiveness of the device Lenar in protection of vestibularis, prevention and treatment of being seasick, of vegetative disorders in the conditions of outer space flight. The experience of the warfare medicine served as a basis for the application of electrotranquilization in industry, in industrial conditions, in psychological regulation centers, in sanatoriums, preventoriums, in cardiology and narcology. Its application in textile industry has shown the effect of higher workability of women workers. Today, we offer drivers to use Lenar. Today, it is known that being in confined space leads to a slow escape of medication from the organism. The statistics has shown that in Europe and the United States, the first place in the course of crashes, automobile crashes, take the tranquilization. The working days of 6 to 8 hours serves as a danger for those that have to take medication when having chronic illnesses. Women can use electrotranquilization during the first stages of their pregnancy for prevention of complications in critical days of their cycle, during the presence of climaterical disorders. Thus, electric signals, they make an additional airbag for automobile drivers, which should take interest of the insurance agencies here and abroad. Our experience shows that the device Lenar at home takes away the collected stress, takes away the emotional load, rehabilitates the working condition, which should reduce the use of alcohol and provide the prevention of chronic alcoholism. There comes a possibility to lower the amount of taken in sedative and tranquilizing medications during neurological and other diseases. A great interest for psychologists and psychotherapists gives my own invented method for preparation for trance and conducting a self-hypnosis with the help of electrotranquilization. At the same time, the tourist companies and travel agencies can recommend Lenar for an easier adaptation of the changes of environment, such as, for example, traveling by air or water. Impulsive current serving as a component of the electroanesthetics designed by us, lowers the amount of taken in pharmacological anesthetics, which allows a patient, especially those of elderly age, to stand long-lasting surgeries in neurosurgery, transplantation, relaxation of muscles and eliminating of fear during electrotranquilization, help to prevent shock of patients with ill syndrome and bleeding, and other medical after-surgery institutions for little children. It is important to supply with this device centers for burn, where pain killing is still done by the use of ordinary drugs. I suggest a creation of a special toy for children with the purpose of anesthesia, which can be conducted based on the scheme on which our device, Lenar, is built. Constant emotional load and the fear of terrorist actions, the problems of technogeneric catastrophes, where the main role is played by the human factor, the increase of depressive states as a result of collected stress, only shows the importance of the usage of electrotranquilization in medicine. Psychologists, psychotherapists, narcologists, they need to use the new direction in giving help, in giving psychological help to people in large cities and smaller towns.